For some athletes, especially women, a constant thought during exercise is whether or not they're leaking. But why can urinary leakage during exercise become such a problem? While urinary leakage can be embarrassing to discuss, it's essential that you seek treatment so that you can continue your workout routines without that burden. By the end of this video, you'll understand why incontinence is so common during exercise and how physical therapy can help.
My name is Leah Lee, and I'm a physical therapist at EW Motion Therapy. I treat a variety of women who struggle with incontinence. And today I want to talk to you about why incontinence may occur during exercise, some risk factors, and how physical therapy can help. Leakage during any type of physical activity or exertional activity is termed stress urinary incontinence. This is a very common form of incontinence. And what happens is you have an increase in pressure in your abdomen or an increase in intra-abdominal pressure. And if your pelvic floor muscles can't support that increase in pressure, or if they're weak, then you might have some leakage that occurs, and it's very common during exercise. So any activity such as running, jumping, even laughing or sneezing can create that increase in pressure and contribute to some leakage. Many female weightlifters will come in and they will have to wear pads during their exercise because they can't form their weightlifting activities without leaking. And it is from that increase in pressure without the support to stop incontinence. There are many risk factors that may be contributing to urinary incontinence, but we're going to discuss a few of them. The first is pregnancy or postpartum. As you go through your pregnancy and as you deliver your baby, there's a period of healing that occurs, and it takes time for your body to regain strength or control of your pelvic floor muscles. Another risk factor is following any type of pelvic surgery, such as a hysterectomy, and this is even more increased with older women or postmenopausal women. Another risk factor is obesity. And then lastly, any type of chronic condition that may create chronic coughing, such as COPD or emphysema. This can contribute to urinary incontinence. While surgery and other pharmacological interventions may be appropriate for stress urinary incontinence, physical therapy is a good conservative approach to treatment. When you come in for your initial examination, your pelvic floor physical therapist will likely assess how your pelvic floor muscles are working. Are they able to contract? Are they able to relax? Are you able to contract quickly? How long are you able to hold that contraction? So we're trying to see what's your strength, what's the tone of the muscle, what's the endurance, and what's the coordination. So it's important to assess that, but it's also important to assess everything around your pelvic floor. So your pelvic floor is a muscle group that sits within the bottom of your pelvis. So you can imagine your pelvis kind of like a bowl. Your pelvic floor muscles are the muscles that sit in the bottom of that bowl. So anything that affects the position of your pelvis will affect the function of your pelvic floor. So you can imagine how your hips move, how your back moves, how your feet move, how your core or your glutes engage. All that's going to impact your pelvic floor. So it's important not only to look at the function of your pelvic floor, but to look at the function of everything else around it. With exercise specifically, you have to be able to move different joints at the same time, and you have to be able to fire different muscle groups at the same time. Once your physical therapist assesses you and assesses how everything in your pelvic floor and around your pelvic floor function, we're able to tailor your treatment specifically to you so that you can return to exercise without leakage. Breath is a huge factor of exercise that will help reduce your incontinence. So you should be able to breathe and synchronize that pelvic floor contraction in a certain way so that you're reducing your incontinence when you're performing things such as weightlifting or jumping or even laughing. So sometimes your pelvic floor physical therapist will encourage you to complete a bladder diary. And really this is just a diary that you fill out, and it gives us a better idea of what activities contribute to leakage the most, or is there other factors that may be involved, such as what you're eating, how much you're drinking, what type of foods or liquids you're intaking. And then we can, again, specifically address what you need and how we can reduce your incontinence. Now that you know more about why leakage may be occurring during exercise and how physical therapy can help, it's important to know that there are other forms of incontinence that you may be experiencing. You may be experiencing one or more of them. To learn more, click the link in our description below to watch our video, Physical Therapy for Incontinence.
If you found this video helpful, be sure to give it a thumbs up and don't forget to subscribe to our YouTube channel to help you on your physical therapy and wellness journey.